In general, many people are following our recent conversations because ang pinag-uusapan ngayon, interzonal travel, people are quite eager not just to go but to first of all understand ano na ba yung policy. Now, yesterday we were talking to Health Secretary Duque, and he was saying, he was acknowledging the complaints of LGUs, but he was also saying, look, ito yung dilemma. Paano yung mga vaccination cards? Di rin naman natin alam kung if we can vouch for that. And as we discuss it, we realize actually it goes all the way back to the basic need for a database, for interoperable systems between LGUs so that there is one national center that can vouch for any card out there. And our question to him, and we'll start off with that question to you, why are we still discussing this? Bakit wala yung database na yun? Bakit wala yung interoperable one center na ganon that will allow all of these things and that will open up these possibilities finally for whether it's interzonal travel, for lifting quarantines, for allowing tourism, and so on?
Thank you, Robbie. Actually, the DICT is still working on it. There are still bugs, I think, in the system that they have created. So until such time that the DICT is confident enough to make that a reliable platform where everybody can check on the vaccination of individuals, then I guess that's the only time that we can have the interoperable database that where local governments can check. And apparently that's actually the same case with international travelers. So the reason why we created this shortened quarantine for those in the green list countries was that the cases in these countries were not putting the Philippines at risk of getting the new variant. But unfortunately, since we don't have access to the databases of other countries and people coming in with their vaccination cards and validating this vaccination card, we cannot yet, as of yet, still allow them for shortened quarantine because of this lack of our ability to counter-check and authenticate. So on the local front, apparently that's the same case. So I hope the ICT will be able to come up with a platform soon and make this accessible to the LGU so that we can get our vaccination card as our, well, quote-unquote, passports to travel to other areas on an interzonal basis. And I cannot blame the LGUs at this time. We do understand the plight of some areas, particularly those that are still experiencing some sort of surge, because the local chief executives are actually the ones who really know the situation on the ground. And they really need to take the lead in putting up measures and steps in order to control the spread of the virus in their area. So I will probably say that our IATF cabinet members are also considering that and respecting the local chief executive's desire to be able to control the surge in their area.
Yes, sir. But do we have a clear timetable as to when this database will be operational? Kahit man lang target dates with milestones.
Well, Ed, honestly, I don't know, but the order has been given to expedite it. I think there were some dry runs that were conducted already, but as I mentioned earlier, the bugs are still there. So let me check and I'll get back to you with the final date if the ICT has a target date already.
End of
General,
July.
do we have any idea what kind of bugs these are? Because, I mean, everybody's been conducting their lives online already. And, you know, there have been so many new apps and programs that enable us to do things online. No? Halimbawa, yung banking system, mabilis, di ba? Ngayon, talagang cashless na lahat, even shopping. So we find it hard to believe that you know, the very job of an IATF, it's a very critical function of government now to really create that database and allow us to monitor. No? Still has yet to be done. So I just want to know what bugs those are.
I think the main challenge lies on the various platforms that are used by the LGUs, because we don't have a common platform for registration. LGUs are using their own registration system. Quezon City's registration system was actually provided by CLIG, and I think they did discontinue that and add another provider for Taguig, which is very reliable. I have not heard of any failure, but this is where the rollout, I guess, is best practice because it's very efficient. Similarly with other LGUs that have not experienced any kind of problems regarding registration and notification of vaccinees. But in other areas, it's different. Those who don't have the money to pay for providers, they still do it manually, unfortunately.
Now, sir, let's move forward on our starting point, why we got to discussing data and databases and so on, which is moving forward, how do we open up interzonal travel and how do we open up business and the economy in general if we essentially have no ID or documentation that can be vouched for by some central database? What's the way forward here in the meantime?
Well, the positive side, Robbie, that I can perhaps share, or you may have heard it already, is that the private sector is very aggressive and very proactive. They're talking about micro bubbles that are creating their own herd immunity in their workplaces because they're very proactive and aggressively pursuing vaccination of their workers. So they can declare certain bubbles within certain workspaces as a micro bubble where everyone is already vaccinated and they can ease up on that. But for travel generally, we really need a central database to allow for the LGUs to counter-check so that they can free up the movement. But the main contributors to the GDP actually is the NCR plus and its adjacent areas. So the best thing to do, in my observation, is to concentrate on that. That's why our experts recommended to concentrate most of the vaccines earlier on in this area so that we can create that people protection or population protection that we have been talking about. So once we have created that, hopefully the virus won't escape to the other nearby areas and we can contain it and we can allow for easing in these areas to allow for a more robust opening of the economy so that we can support all the rest of the country.